Millions have found ways of coping with neck and back pain using medication and compromised lifestyles, or they believe that invasive surgery is their only option. People who have suffered with pain of spinal problems are often willing to do anything to get their life back. Instead of making false claims of eliminating the need for open surgery, Boulder Neurosurgical Associates, or B&A surgeons, treat all types of brain and spine disorders with a wide variety of treatment options. B&A and affiliated providers offer services that range from physical medicine and rehabilitation to local and regional injections to an extensive array of minimally invasive and endoscopic surgical techniques. B&A's multimodality approach to patient care initially focuses on conservative management of the patient. If surgery is necessary, our surgeons utilize state-of-the-art, minimally invasive surgical techniques. These types of techniques are applied to all aspects of cranial, spinal, and peripheral nerve disorders. B&A's physicians and surgeons have given hundreds of talks in national and international meetings, published extensively in the medical literature, and have literally written the book on some of these techniques. As a principal investigation center for multiple United States Food and Drug Administration, or FDA studies, B&A has led the field in clinical testing and evaluating various new devices, including the newest dynamic motion stabilization systems, as well as lumbar and cervical artificial discs and other novel technologies and treatments. B&A's Minimally Invasive Spine Institute, or MISSI, is an outpatient surgery center designated solely to the treatment of spinal disorders through less invasive treatment methods. This includes percutaneous endoscopic laser spine surgery, epidural steroid injections, diagnostic discography, facet blocks, rhizotomies, outpatient cervical and lumbar interbody fusions, and many other outpatient techniques that, when performed elsewhere, require several hour surgeries and several days in the hospital. A leader in minimally invasive surgery, B&A can help you get back to the life you knew before your spinal pain.
In the fall of 2003, I had 2 consecutive accidents. One morning I woke up to go to work and I literally froze. I could not move. I've been an athlete my entire life. I was racing triathlon, running marathons, so I've been very active. The more I had back problems, the worse my life became. I was angry, I was short-tempered with my children, and I really couldn't even do simple things like sit down and read a book. I wanted desperately to run without pain and swim and bike. So I came to Dr. V twofold. I wanted something done immediately, but I also did not want to have to wait several months to rehab to get on with my life.
By utilizing state-of-the-art minimally invasive surgical and non-surgical techniques, patients are often able to return to their previous active state without the use of invasive surgery. B&A surgeons are part of only a handful of spine surgeons in the country that have dual training in both neurological surgery and orthopedic spine surgery. Techniques such as intraoperative 3-dimensional fluoroscopy-based computerized tomography guidance for percutaneous kyphoplasty were first developed and described in the literature by B&A surgeons. This allows for the reduction of vertebral fractures through a pinhole in the skin instead of a 12-inch incision, and patients can go home in as little as a few hours after surgery. Some other minimally invasive techniques used by B&A surgeons include interspinous process decompression systems, percutaneous fusion techniques, and spinous process fixation systems that do not require pedicle screws, dynamic motion stabilization devices, and the most advanced motion preservation technology, including cervical and lumbar artificial discs. B&A surgeons are primary FDA investigators for almost all of these various technologies. B&A surgeons also founded the only CyberKnife radiosurgical system in Colorado. This non-invasive neurosurgical technique utilizes focused, high-energy radiation to attack and kill tumors and vascular malformations of the brain and spine. It's like having surgery without a knife or incision and on an outpatient basis. With its innovative operating facilities, the neurosurgeons at B&A utilize the newest generation of intraoperative image guidance systems, such as the Polestar N20 Intraoperative Magnetic Resonance Imaging, or MRI system, the Siemens isocentric three-dimensional fluoroscopic navigation unit, with computer volumetric navigation based on preoperative images. The newest revolutionary O-arm intraoperative imaging system is the only system that offers complete, multi-dimensional surgical imaging. B&A is the second practice in the U.S. to acquire this new surgical imaging system. The O-arm allows B&A surgeons to obtain 360-degree images around the patient during surgery. They can also verify the placement of surgical implants in the operating room.
And we had MRIs of my entire spinal column from my cervical all the way down to my lumbar spine. He basically said, "No, I will not operate on you." And so that's when non-invasive procedures came into light and turned out to be the best thing, because I did not have to take any time off of what I was doing and basically get the benefits of resuming my lifestyle.
Anita, like hundreds of patients, was placed on an intensive rehabilitation program in conjunction with non-surgical outpatient procedures that resulted in immediate pain relief, which became long-lasting in conjunction with ongoing focused maintenance treatments.
It's pretty amazing to think that there was a point where I was waking up in the morning feeling like I was 120 years old. Believe it or not, I got into yoga school several months later, after about 18 months of rehabilitation, and I instruct yoga now. I can do back bends, I can do twists. I've got my life back.